Good morning, and welcome to another episode of Issues That Matter. And I know this is going to sound a little bit self-serving, but I think we have a real good show for you today. And I'm honored to have ANDREA IRWIN, Esquire. And ANDREA is the Legal and Policy Director for Cover Maine Now. And Cover Maine Now is one of the driving forces behind the effort to expand Medicaid, which is a very important issue, very important topic. And it's one that always holds the possibility, but it's not going to have it on this show, of becoming too hot for conversation. But again, that's not going to happen on this show. And ANDREA and I committed to that jointly. But I had the occasion yesterday of attending a meeting of an organization called Maine Health Allies. And one of the observations that was made at the meeting, which was met with unanimity, is that one of the things that we lack in our society today is the ability to agree to disagree, number one, and the penchant, if you will, for talking at each other and not talking to each other. And again, that was another thing that we briefly discussed back in the green room, which has nothing green in it, by the way. So ANDREA, I want to thank you very much.
Oh, thank you. I'm very happy to be here.
Well, happy to have you here. And I think I mentioned that you were the Legal and Policy Director.
Yes.
Of Cover Maine Now.
Actually, of Consumers for Affordable Health Care, which is a group that's part of the coalition of Cover Maine Now.
Oh, okay.
Yes.
So, okay, mistake number one.
That's okay. It's a minor one.
Okay, thank you. Thank you. So tell me, what is Cover Maine Now? What are they doing, and what might it mean? Well, sell me on the idea of expanding Medicaid.
Okay, I'll start with the easy question, which is about Cover Maine Now. It's a coalition of more than 100 organizations and businesses from across Maine. It's a very broad coalition. It includes healthcare providers. So we've got the Maine Medical Association as part of our steering committee. We've got United Ways, the Roman Catholic Diocese, all of the different voluntary health organizations. So the American Heart Association, Lung Association, Diabetes, American Cancer Society, Cancer Action Network in Maine, AARP, the list goes on. And it's just a really huge, vast, diverse group of organizations that all support this one issue. They all think it's important to bring these federal dollars into Maine to cover more people with health coverage, taking advantage of these incentives while they last. The harder question, I think, is to convince you, because I know you're a little skeptical, which I appreciate, and hearkening back to what you said earlier, this topic has really become a hot button issue. And one of the things that I find really encouraging is that across the country, we're hearing from people in what are traditionally considered red states that their governors are taking advantage of this and that they're actually doing Medicaid expansion because they think that it does work for their states. They think that it's a good use of federal dollars. The money's already been set aside. They know that people are uninsured, and they know that people are going to use those healthcare services anyway. They know that people are going to need to go to the emergency room. So it just makes more sense to take the money, provide the coverage, get people into preventive care, get them the care they need when they need it so that they can avoid more expensive care later.
It makes a lot of sense. Where you might say I don't get on that train is when I think about at what expense. We have a federal government that is not billions of dollars, but trillions of dollars in debt. And Alan Greenspan just released an article that says that if we can't get a handle on inflation, we're looking at 5 to 10 years of significant inflation. And when you consider the trillions of dollars in debt that we're in now, when you apply the inflation factor to it, now you're talking about mega trillions. And the hope of paying that off in my lifetime lies somewhere in that slim area of slim to none. And I would not be too partial to laying it off on my grandson, who's only 6 years old.
I appreciate that. I absolutely do. I think it's really important to be thinking about the impact that this has on both our state budget and our federal budget, because budgets are about priorities, and we have to think about the limited resources that we do have and where we're putting our dollars.
And I think it's important to keep in mind that, and we had some discussion back in the green room, which again doesn't have anything green in it, but we had some discussion back in the green room that, and we are, I think I can speak for both of us. We both have the same goal, and that goal is to have health care, insurance, affordable, accessible to everyone. So we have the same goal. The problem that we have is sometimes we lose sight of the goal because we get tied up in the intricacies of the route that we're going to take.
That's right. That's right. I think you're right about that. And I think this issue in particular has really gotten people into their corners, so to speak. And that's really unfortunate because we all do share the same goal. I think everybody in Maine wants a state that is prosperous. We want our citizens to be healthy. We want people to be able to go to work. We want people to be able to take care of their children and be participating in their communities to the best of their abilities. And that's why the groups that support the mission of Cover Maine Now are so committed to this effort, because we really feel like when you look at the federal dollars that have already been set aside, it is the smartest use of dollars available to us. And I absolutely hear what you're saying with respect to the federal budget deficit. I'm concerned about that too. I don't want to live in a world where I'm not going to get Social Security, or I'm not going to have the ability to get retirement and things like that. So I certainly do understand that and appreciate that concern. The problem with the uninsured, and particularly the people in this group who are the people that are really low income. These are people with incomes for one person living on their own, but below 100% of federal poverty level, which is around $15,000 a year. That's very low income.
Oh, very low.
Very low.
You can't survive on that.
You can't survive on that for whatever, health care, fuel for your car, paying your bills, whatever, different type of living we're talking about. But no matter what, the money, people need these services anyway. So the problem we're seeing here in Maine and in other states is that the funding is coming from other places. So for example, people that are uninsured are relying more heavily on our safety net providers. So our community health clinics are seeing an increase in care, and they can't afford to pay for that because that money is coming from federal dollars as well. Same for our hospitals. Our hospitals are seeing an increase in uncompensated care and charity care. If someone shows up at the hospital, they have to provide care. They do not have a choice. It's the law. And thank God for it. We appreciate that.
Yep.
They do a wonderful job of providing care to our citizens.
Absolutely agree.
But unfortunately, again, the money has to come from somewhere. And so there's this cost shift happening. And what's great about this federal money that's been set aside under the Affordable Care Act to do Medicaid expansion is that it's a really efficient use of money. There's a match rate that's 100% through the end of 2016. And so if Maine takes those dollars, we can ensure that people are getting that care and they're getting covered. Having health coverage means that people are insured. They can go to the doctor. They have an actual insurance card. In this case, it would be Medicaid. And they know that they have that financial security if something goes wrong.
Now, for purposes of clarification, and I don't think too many people refer to it as Medicare or Medicaid.
Right.
They refer to it as Maine
Care is
Maine
the main
Care.
program. Yep, that's
Right.
a good clarification, exactly. Yep,
But that Maine Care is Medicaid.
yes.
And it's, it's a difficult decision. It really is.
It really is. And, I have to tell you, I do not envy our legislators in having to make these tough choices. Right now in our Health and Human Services Committee, they're in work sessions and they're looking at all the different programs and they're really trying to determine what is the best use of our resources and looking at the budget, and it's really difficult. And there's a lot of there's a lot of complicated factors, I should say, when looking at it.
I would love to be, and I'm too big to be a fly on the wall, but I would love to be a fly on the wall.
Well, the good news is they're open to the public and you can listen to them on audio. To the extent that you want to sit, day after day and listen, you certainly can, to the extent that you want to commit that time to it.
Maybe before you leave today, you can tell me the website that I
will
would
do
have
that, yes. It really is interesting because there's really great debates happening in our legislature up in the State House that are really important and really impact people's lives, particularly seniors, particularly people that are very vulnerable, that have health issues, that really rely on certain healthcare programs.
I did some, in research that I did for the show, I did some reading on the budget proposals that our governor has put forth. And one of the pieces that I read talked about the amount of monies that he is directing towards helping the disabled people, the elderly people. And after reading it, my mind told me it looks like they're taking money from, they're going to be taking money out of that pocket that helps the truly needy, the disabled, the elderly. Take money out of that pocket in order to provide things for people that are essentially, yes, their life is not easy for them by any stretch of the imagination, but they're not disabled, they're not elderly, and it just, sometimes in life you have to make very difficult choices.
Yeah, and unfortunately, I'm not an expert on the budget overall, and I haven't looked at it as carefully as I would like to comment on that. But I think that's what's really challenging right now is that when you look at the budget and you look at particularly the Medicaid program, the federal Medicaid program, and again in Maine we call it Maine Care. It's a little complicated because the federal program applies different matching rates to each category of people. So, for example, if you're someone that's in the disabled category, the federal government is going to give Maine a certain match rate for that type of person. Versus if you're not disabled and you're in this category of people that we want to expand to cover, you're going to get the most favorable match rate. You're going to get the full 100%. Similarly, in other states, we're hearing studies that show that states have been able to actually move using state dollars to pay for people that need mental health services, behavioral health services, all those kinds of programs, and use this federal matching money. So that's saving state money too. So again, it's a little bit complicated and wonky, and it can be really difficult to follow, particularly, again, as we sort of delve into the budget issues a little more deeply. But I think that's what's so promising about the federal dollars offered through this Maine Care Medicaid expansion is it really does allow Maine to take advantage of some incentives that are really quite favorable in the short term and the long term, but really in the short term, looking at, in the next 2 years in particular.
Correct me if I'm wrong, but under the proposal, at least under the proposal last year, federal government will pick up the tab 100% for the first 3 years. After 3 years, a state could opt out of the program.
So a state could opt out at any time. So for example, Maine could decide to do this for 6 months and then change its mind. We could do it for a year and then change our mind. But the 3 years actually started in January 2014. So at the end of 2016, that 100% match will go away.
Okay.
So we're so we only have really a little under 2 years of that.
Here's the issue with that. And I'll use the 3 years as the timeline. After 3 years of having it, it would be political suicide for the state to say, we're giving it up. Once a person gets it, they're not going to want to give it up. But if the state can't afford it, they're going to be in a position where they have to give it up because they just can't, especially the state. The feds can manufacture dollars.
Do they have a secret machine I'm not aware of?
Well, they can.
Yes,
yeah,
they have a bigger
It's called a printing
resource.
press.
Yes.
In the Treasury Department. Unfortunately, as they manufacture dollars, it devalues the value of the dollars that are already out there.
Right. No, that's a really good point, and I think that's something that we've heard people talk about a lot. I think the response to that, though, is that this is not a stagnant population. Just because you're in the coverage gap now doesn't mean that you're going to be in the coverage gap in 6 months or a year from now.
And when you say the coverage gap,
so these are the people below 100%.
Okay.
And to clarify, so under the Affordable Care Act, there are people that can get subsidies or tax credits to buy coverage on Obamacare, the marketplace, but you have to have income that's 100% of the federal poverty level or above. So if you're below that, you don't qualify. And again, that's because, the way the law was written and then the Supreme Court made the decision in 2012, and then here we are having this conversation. But I think it's really important to remember that this is a population of people that are working. Nearly 70% of them are estimated to be working. They're working low-wage jobs, but they're not necessarily always going to be in this income bracket. So to think that these are people that are just going to get this Medicaid and then just sort of take it and not be mobile with it is not necessarily accurate. So I like to think of it as it's a safety net for people when they need it. They won't always need it. And I think that is an understandable argument. But again, let's just take the money while it's there, and then we can worry about that later if we have to. But in the meantime, there's just so much available to use in terms of taking advantage of the incentives. And if we really are worried about state funds, let's take the federal funds. They're just sitting there. They're not being used for anyone else.
True. But then I would say that they're not sitting there. They haven't been printed yet.
They have been printed.
No,
they really have.
The dollars have not been printed yet.
No, they really have. I mean, truly, in this particular situation, the federal funds have been allocated, appropriated, which in Washington is a hard thing to do. And they are sitting there. they're in an account, and they have Maine's name on them. And we just need to say yes and check a box, and they will come flowing. It's really that simple.
Well, it's complex enough that I'm going to need a little bit more time to think about it.
That's fair. That is very fair. And it's a lot of money. So I know when we're talking about millions of dollars, it's never that simple.
Not millions, we're talking about billions.
Right.
And, it wasn't, I may be experienced, yearly wise, I'm experienced in life. But then most of those years, $1 million was a lot of money. Mm-hmm. In today's, now we're talking about trillions, which back then you couldn't even imagine it.
Right.
So and I think it's quite natural to be very concerned about it, which just gives us more reason to talk about it and discuss it, and always recognizing that our goal is the same. Mm-hmm. And don't get waylaid off of that goal by discussing the minutia of how to get there.
Yes.
By discussing the route.
Yes.
Then I have a cautionary word for you. You're agreeing with me, and in a lot of people's minds, that would not be a good thing.
No, but I do. I agree that we have the same goal, and I appreciate wanting to focus on that, because I think too often in these discussions we forget that, and I think particularly right now, the route, so there is this one route we've been talking about here, but there are actually a couple different routes, and that's with a waiver. There are a bunch of states that have, and again, these are some of the red states that have taken advantage of an option available to them through the federal government to come up with what they think works better for their state. And Probably the most well-known is Arkansas. They were the first to do this. They introduced a waiver, and it's called the private option. And so what Arkansas has done is they've taken these federal funds and they've essentially bought private plans for the people in this population that would otherwise get main care
Yep.
and put them into the private marketplace plans. And that's another option that we could consider. So there are other routes to talk about. I think that there are certainly reasons that that could work really well in Maine. The provider reimbursement rates are very good for our hospitals and some of our other providers, so that's another reason to look at those. Obviously, there are concerns. Medicaid is a program that works really, really well and is really comprehensive for people with low income. So when you look at a private option, you want to make sure that there are protections in place. But there are alternatives, and so I think this is a really good time to be looking at what are those other options available to us.
Well, I would like to think that shows such as this one could be a starting point to have that discussion, because it needs to be it needs to be talked about. We've got to be able to get over the differences that we have en route and come together in a strong enough fashion, come together in a fashion that will allow us to achieve our goal.
Yes, I agree, definitely.
Now, there was something else floating around in the caverns of my mind, and sometimes the caverns get big. We talked about the disabled and being the most needy. Now we have, in the offing, we have a issue that's out there relative to elder care and dementia. And people are living longer these days, and dementia is becoming more and more of a factor in a lot of people's lives. And funding and the wait list to get into nursing homes funded by Medicare is exorbitantly high, and it's scary. How would what we're talking about today impact that?
That's a good question. I think that is a really important issue to look at. And again, it's complicated because the funding streams are a little bit different, unfortunately. You know, I think when you really look at the big picture, one way to think about it is if people are getting covered at a younger age when they are healthy, and you really help them, you know, establish a relationship with their doctor, get into primary care, get treated for illness before it gets more serious, you can really help them get a healthier start so they're not going to get those illnesses at a later age and need things like nursing home care as early as they might otherwise. For example, we've heard just recently there were some studies that came out that in some of these states that have done the Medicaid expansion, the ability to determine patients that have diabetes is really increasing, and they're able to treat people at a much higher rate. And that's helping people get healthier, it's helping the state's economies, and it's ultimately going to lead to a better aging population. There won't be as much disease as people get older, and it will really help impact that need. And you know, of course, in Maine, we're the oldest state in the nation, and so that's something that I think
Oldest and the most rural.
Yes, and so we have challenges.
Which is another major challenge.
Absolutely, we have huge challenges here that are very significant, and I think in terms of this funding, you know, it doesn't have to be either or. I really do feel that if we look at the formulas and the opportunities that are available to us, there's no reason that Maine can't take these federal funds, and in a year, we would see state savings that would allow us to provide care to some of those groups that you're talking about.
Now, what do you perceive to be the gist of the objection that Governor LePage has towards accepting the federal funds?
That's a good question. You know, that's something that we really are curious about, because we did hear him say during his reelection campaign and even more recently that he does believe that there should be a solution for people below 100%, so the people in that coverage gap. We haven't heard him talk yet about specifics. I do get the sense that part of it is feeling like it's the federal government's fault and that it shouldn't come to the states at this point, which I think is difficult because, you know, it kind of becomes a hot potato and nobody really wants to deal with it. And at this point, we just want to meet our goal of having people get health care when they need it. But I think he is open to the idea. We certainly hope he's open to the idea of helping people below 100. And again, those are the people that are going to our safety net providers, going to our hospitals, going to the primary care health centers in our communities, and really putting a strain on those facilities. And it would really be great to find a solution.
It's putting a major strain on the facilities. Not only the nursing home facilities, but hospitals, regional hospitals.
Yep.
Those small little, you know, small hospitals in relatively small communities that are not able to survive.
Right.
I know, there's a phrase, money is the root of all evil. Well, money is the root of all evil when it comes to being able to pay it back or
Right.
being able to afford something. And there are hospitals that are closing up because of their lack of ability to afford it. It just speaks to the complexity of the issue at large. Now, I did in the research that I did do relative to the governor's budget. I'll just read a little piece. Among the critical funds are $46 million to provide home and community-based care for elderly and disabled people on Medicaid wait lists. These are people that are waiting to get into a nursing home. That Medicaid would pay for. And these are the people that, if we take more money out of the Medicaid budget, the Medicaid pot, so to speak, these are the people that are going to have to wait that much longer, if they can ever get into a Medicare nursing home,
Right.
a Medicaid nursing home, and it just makes the problem that much more difficult.
Yeah, and I just want to make a clarifying statement on that.
Okay.
It's really I think the governor there is presenting a false choice, because we don't have to make the choice between people that are on the wait list for home and community-based services and the Medicaid expansion population. There's money in the state budget to take people off the waiting list for the home and community-based services. Again, I am not a budget expert. My friends at the Maine Center for Economic Policy are, and I would actually encourage you to have them come on and talk about the budget, because they are great and they've done fantastic analysis.
I wouldn't know how to talk to them.
I know, believe me. Sometimes I'm sort of like, what did you mean by that? And I have to sort of ask for clarification. They're really smart and they do a lot of great work on the budget. So, but my understanding is, we don't have to be making these hard choices, and it really does not come down to one thing or the other. It's not an either or choice. So again, we can take this federal funding, we can provide coverage to these people that are working, that are low wage, that might need some health care to help them get back to work, and we can also take people off the wait list. It doesn't have to be either or. So I think that's a false choice that the governor's putting out there.
Okay. And I'm not a spokesman for the governor. And frankly, I don't think it would be too healthy for me to become a spokesman of the governor.
That'd be a tough job as well.
More so for the reason that he might not like all the things that I want to say. But I just thought it would be information that should be out there for people to digest and make their own decisions. Let's see. What would you say is, in your mind, the overriding concern about whether we should do it or not? If you haven't already, my guess is that you probably already stated it.
I don't know that I have stated it. I mean, for me personally, it's really about doing the right thing. we've talked about the economy and, this would create jobs for people and this would, help people get to work.
This would create jobs for people. Explain that.
Oh, so there's numerous studies, particularly in states that have done the expansion, that this would create more jobs in our healthcare sector. So for example, we were talking about potentially having hospitals close. This would prevent that from happening. This would potentially bring in dollars to our hospitals because, again, with the way it is right now, people that are uninsured but are still getting sick are going into the hospital. The hospital has to pay for that with other funding. This would boost the hospitals with the federal funding and enable them to hire people to pay for those, or excuse me, to provide to provide care to those patients. So there's studies out there. There's the Fitch jobs report that just came out recently. I could share that with you, and that's been showing that increase in jobs. And but really, again, for me, it comes down to this is the right thing to do. When someone is working 3 or 4 jobs, trying to make ends meet, it just seems to make sense to provide that person with access to health care. I think that when someone is uninsured, they're that much less likely to go to the doctor and get care when they need it. They're going to put their health needs off, and then they're just going to end up getting sicker. And I want to live in Maine. I grew up here. I moved away and came back, and I want to live in a state where we all support each other. It's a vibrant state. We are all, we're a healthier state where people are working and going to school and accomplishing the things that they want to accomplish, but they need health to do that. That's really what it comes down to. And I think that's the goal that we share.
Yes, very definitely. I think we probably share a lot more goals than potential goals that we may differ on. And it's always important to realize that and recognize that. That way you can keep the conversation alive. All too often in today's world, the differences become obvious, and people become more aware of the differences, and they stop talking.
Right.
And we've lost our ability to agree to disagree, not losing respect. And those people who are strong advocates of something like this, I have a high degree of respect for them. I may not agree with them, but I have a high degree of respect for them, and I know that their motivations are honorable. Their motivations are based on their knowledge and their train of thought. Their motivations are what is best for the people.
Right.
Others, they see the world a little bit differently. It doesn't make them bad people, but they see the world a little bit differently. And it's important that we are able to continue having conversation, because it's out of conversation that solutions are found. Solutions do not come down to us from on high.
It would be nice if they did.
Assuming we agree with the solution.
Right.
But it's critically important, and I'm an advocate for multiple sclerosis. I'm very active in it, and I will take this opportunity to share that we are in the process of trying to get a bill through the legislature, and we made it through the budget committee to give tax advantage income tax credits to people who are disabled, to make the modifications on their home to make their homes more accessible.
Yes, I'm aware of that bill. Great.
Which I'm proud of it. I serve on the government relations committee. I'm proud of it, and I think I'm hopeful and I'm optimistic that it's going to make it through the legislature, which would be a great thing. And I will also say that Mary Mayhew is on board. I believe Mary Mayhew is on board with it.
Oh, good.
She's in favor of it. And we've gotten support from groups such as AARP, Coalition for the Disabled, Alpha One.
Great.
So that makes me feel pretty good about it.
Good.
I like it.
Yes.
I like talking about it.
That's great.
But the goals are the same. We just have to be able to navigate the roads, making sure that we're on the same route, on the same road, and that we agree on the road that we're on the route that we're on. What would be your takeaway item, so to speak?
Well, I would just really encourage your viewers to take another look at the issue, because most people by now, if they're familiar with this issue, and I'm sure they are, at this point it's been in the news for a couple years now, take a look again. You know, there's been new studies out, particularly now that it's been done in other states. We've got some studies that have come out showing what the results have been. So we're not just predicting now, we're actually seeing, okay, what does this actually mean in states that have tried expansion, either doing a regular expansion with the Medicaid program or the private option that I mentioned earlier. So I would encourage people to really look into the issue. For those that do support the issue already, please visit our website, covermainenow.org. And if you do support it, you can sign a petition that will go to the legislature. There are a couple bills that are being considered this session. We are hopeful that those will be considered very soon. We expect a public hearing within the next several weeks, probably mid to late April, before the Health and Human Services Committee. And I really just hope that people will have an open mind and, again, look at all the facts before them and consider the impacts, you know, both from what's going on here in Maine from the state budget perspective, but also just thinking about the people in their lives, your neighbors, the people that, you know, give you your, pump your gas and take care of your kids, and maybe that you see at the neighborhood market. Those are the people that are in this coverage gap and that could really benefit from this Medicaid expansion.
I'm gonna just say, hinge something to that. Is that we want our leaders to lead, but we don't want to be led around. We want to have a voice in the direction that they're moving in. So I encourage people to contact your local legislator to tell them what direction you want them to take. Don't leave the decision-making process totally up to them. They were elected for a reason. Take advantage of it. Don't be sitting back in the bushes and waiting to criticize the decision that was made when you never did anything to influence the decision. Does that make sense?
Absolutely, yes.
Oh boy, put that up on my pin board. Andrea, it's been a pleasure having you on.
Likewise, thank you.
And I'm going to ask you, number one, to send me the studies that you've referred to.
I will.
If you can send them to me, I would greatly appreciate it. And number two, I would like to have a commitment from you to be back on the show again.
I would love that. Thank you.
I enjoyed our conversation. I think it was productive. I think we shared some ideas, and
Yes.
I think we demonstrated that, yes, two people who might have a differing opinion can talk civilly.
Absolutely, yes.
And so if that sets an example for others, so be it. Have at it. So until the next time, folks, have a good time. Make it a safe time. And I do have some things in the works for additional shows. I believe on April 10th, I'm going to have a spokesperson from the National Multiple Sclerosis Society on, who's the co-chair of the Government Relations Committee. And she's going to be talking about the advocacy that is being done. And I've got other things. Let's see, the Maine Health Access
Oh,
program is going to have. I'm going to have Dr. Wendy Wolf.
she's great.
Now you're putting the pressure on me.
Well, and I'm sure she'd like to talk about this topic too.
Oh, I know she would.
So
I know she would.
you're going to be ready.
Well, that's giving me that's giving me possibly too much credit. But folks, have a great day. Make it a safe day. Take advantage of those gems that you have in your own backyard, and we have our share of them. And simplify your lives. Make life a little bit simpler in this ever complex world that we live in today. Have a great day, and I'll see you the next time. Bye-bye.